Having said that, I want to say that we as a country have, over the last 2 months or so, been engaging very seriously in developing our plans and contingency and action plan on how to deal with the coronavirus. A lot of work has been done that maybe has not probably been properly communicated to the media. We have a contingency plan. We have certain action points that have already been taken in terms of preparedness. As you can see, we have instituted measures of surveillance, of screening at all our ports of entry, temperature screening for all passengers arriving from everywhere, with particular focus on those who are coming from the risk areas. We have improved the number of staff, healthcare workers under our port health system who conduct this screening and obtain the necessary information. We have a very active emergency operations center under our Department of Disease Surveillance and Response that responds to any suspected cases or alerts that we are informed about and quickly moves forward to address these alerts. We have built our laboratory capacity. We actually have had laboratory capacity all along. What we didn't have is the specific reagents. For a while, we didn't have the specific reagents for this new virus that are required to identify it. It's an entirely new virus, and there was a process of study that had to be undertaken to identify targets that will be able to detect this. We now have those reagents in place, and apart from, I think, three samples that we sent out to South Africa, we are now doing all our samples here at 2 laboratories that have the capacity to do this testing. One is the National Influenza Center under our National Public Health Laboratory, and the second one is under KEMRI. So we have capacity in that area as well. Equally, we are working on enhancing and building capacity in a number of different areas. And I would like at this point perhaps stop at this, because I want to allow the Director General now to be able to read his statement, because it is his statement that actually elaborates on the preparedness measures that we have taken as a country. Thank you. Dr. Amoth, our DG.
Thank you, Waziri.
Can you move here so that you can?
We swap seats. Thank you, Chief Administrative Secretary, Minister of Health, Dr. Rashid Aman. We'll now read the official press statement from the Minister of Health, and it will address some of the matters that the Chief Administrative Secretary has already spoken to. As at 26th February 2020, globally 81,109 confirmed cases and 2,762 deaths have been reported in China and 37 other countries. In terms of the preparedness measures, the ministry continues to maintain the heightened surveillance system at all points of entry, health facilities, and communities across the country. So far, the ministry, through its surveillance system, has been able to pick 17 alerts, all which tested negative for the disease. Further, the government has put in place the following key interventions. Number 1, as mentioned by the CAS, the contingency plan. The country has developed a national contingency plan to guide implementation of priority preparedness and response activities in view of the threat posed by importation of COVID-19 into Kenya. Number 2, in terms of governance, we have adopted a whole government approach and a multi-agency approach at 2 levels. 1, technical, where the principal secretary sits, and policy level, where the various ministers sit. Below that, we have the task force, which sits every alternate day. Through these ministries, departments, and agencies, have been brought on board as one government to deal with this threat. Number 3, activation of the Emergency Operations Center. The Emergency Operations Center has been activated and is closely monitoring the evolution of the outbreak across the globe. In addition, the rapid response teams are on standby to investigate any alert anywhere in the country. In terms of diagnostic capacity, as the Horn's Cabinet Chief Administrative Secretary has stated, we have in-country capacity to be able to now diagnose at 2 laboratories, at the National Influenza Center, under the National Public Health Laboratories, and at the Kemri Reference Laboratories. Number 5 is in terms of screening. Mandatory screening is ongoing at all points of entry to minimize the risk of importation of the virus from the 38 affected countries. As at to date, a total of 320,123 travelers have been screened across various points of entry since 20th January 2020. In terms of human resource preparedness, we have trained 615 healthcare workers in both the public and private health facilities and at all points of entry on how to deal with any suspected cases. And we have also deployed additional healthcare workers to the Jomo Kenyatta International Airport, our premium aviation hub. In terms of isolation facilities, number 7, we have an isolation facility at the Kenyatta National Hospital, which continues to be used to isolate suspected cases which meet the case definition criteria for further investigation. The government has also taken over a new ward with a bed capacity of 120 at Magadi District Hospital to further increase our isolation capacity. In addition, all the points of entry have isolation or holding facilities and are prepositioned with appropriate personal protective equipment. Further, the Ministry of Health has met with the Chief Executive Officer for major private health facilities within Nairobi County to support provision of additional isolation facilities in the event that the country reports more cases than can be handled at Kenyatta National Hospital and now Mbagathi. In terms of personal protective equipment, which is also key, especially for the healthcare workers and the support workers, especially at the points of entry like customs officials, immigration officials, the security officials at the airport, we have prepositioned adequate personal protective equipment, including the hand sanitizers, at all our points of entry. The ministry advises members of the public to remain vigilant as the risk is still high and this is a rapidly evolving situation, and to continue taking the necessary precautionary measures by maintaining basic hand and respiratory hygiene, safe food practices, and avoiding close contact with people suffering from acute respiratory infections. In addition, anybody showing symptoms of respiratory illness, such as fever, coughing, difficulty in breathing, and sneezing with a history of recent travel to the affected countries, is advised to visit the nearest health facility for assessment and prompt management. Further, we would wish to advise that all non-essential travel to the affected countries be effected by Kenyan citizens. To further confirm our preparedness, I have here information from WHO Afro region, which was published on 13th of this month, looking at 2 key areas. One was preparedness. You can see the countries in green: Algeria, Cote d'Ivoire, Cameroon, Kenya, Ethiopia, Tanzania, and Madagascar. These countries were rated green in terms of the measures, preparedness measures that they are put in place. In terms of ability, again, of the countries to be able to test for COVID-2019, and I'll be able to share this with you Again, you can see Kenya is in the green shadow, meaning that we have local capacity to be able to test for the virus in country. Thank you. Waziri, you have to come to.
Ask questions, at least stick on the agenda of the day. So please tell us your name and your media house before you ask the question.
Yeah, I will check.
My name is Gloria Milin from K24. Dr. Aman talked about the government taking over a facility, a ward at Mbagathi District Hospital. And from the previous press statement issued on 13th of February, you said it's 120 bed capacity. Today I visited the facility and it's just a building. So nothing going on. It's just a building with old equipment yet to be used. Maybe if you can clarify on this ward that you've taken over at the government. And then you've talked about self-isolation. So who is monitoring to ensure that those who are self-isolating are actually doing this? Because you've seen on social media, guys even just complaining, saying that they have neighbors who allegedly were part of the 239 passengers who came in from China, and they are mingling freely with the public. So how safe are members of the public, if you can just address those issues?
So we can take another one?
My name is Jane Gray from NTV. Had a very saying that Kenyans should avoid traveling to that question, to those countries. My question is, why not impose a travel restriction? Why not just deny access to the Chinese from coming to Kenya? Why are you putting the lives of Kenyans at risk?
Any other? Graham?
My name is Graham from the Standard. What I would like to understand is how can you convince Kenyans that the measures you put in place are going to work, considering that other countries which have better medical equipment, better vascular medicine, actually blocking. They don't even, like Russia doesn't even want to see the Chinese around the country, around the airspace. But Kenya is so much younger, yet we are not so sure how advanced our medical system is to handle such a crisis.
Okay.
So maybe they can respond to that before we take
Yeah.
another round.
Let me respond to that, and I will ask my colleagues if they want to add anything on it. I think the first question was regarding the Mbagathi ward. The Mbagathi ward is when we...
Please, sir.
You can't hear? Okay. The Mbagathi ward that the government has now taken hold of is indeed a building that was intended for other purposes. And as a national government, we took it over because it serves our purpose of setting up an isolation facility there. So there is work to be done in terms of creating those spaces, creating the spaces for the divisions so that we can have the 120, and the capacity is 120 beds. That work has been planned for and is actually in the works. We are going to start to do that in the shortest period of time. We should have that facility up and running and ready to receive any cases that turn out to be positive for this. So it's work in progress. We are speeding it up. It will be there. We are on a fast track mode. I think we have set ourselves that within the next, certainly within the next 1 month or so, we should have that facility operational. In the meantime, we have 11 bed capacity at Kenyan National Hospital. And I think that is enough for us right now to deal with any situation unless we get an increase in numbers. But we think we can meet that target and have that facility ready. With regard to self-quarantine and what it means to self-quarantine, self-quarantine means that the individual must remain indoors and away from other people And I think all of these passengers who are coming from China, and especially those who are the workers, because most of them are the workers working with the companies here, they have very strict instructions on how to do it. And most of them are doing this with fidelity. We know this because the embassy, we know this because we work closely with the Chinese embassy, who also helps us monitor. And again, to answer that question of who monitors, this is the work of now our teams, our response teams, both here at the national level and also linked to our county health systems, where we have cases in the counties. There is a linkage system where immediately, if there is information coming from the counties, it is linked to the response team here, who are then able to go and assist the county team on how to deal with it, or go down there and deal with it. Okay. So those systems are in place. About mingling with the crowd, I know that there is a lot said. I cannot say what is true and what is not true, but the measures that we put in there, we make it quite clear that for the system of self-quarantine to work, this is what must be done and must be observed. 14 days of quarantine.
So during these 14 days, what should they do? What is expected?
Self-quarantine means you remain indoor, and you monitor yourself. If you have any symptoms, they have information on who to contact or call, and then they will receive that medical care. But the team also have their contacts, and they call them periodically to find out how they're doing.
With the case in Kitui, I was there, and then these Chinese they came all the way from JKI in a car, all the way to Kitui. In terms of contact tracing, what are you guys doing? Because as much as these people will self-quarantine, then what becomes of these taxi drivers? Is there a procedure for contact tracing?
Yes, there is a procedure. There is a procedure where this information is supposed to be recorded, both by the individual themselves and the team who will be sending them in a taxi or wherever. Sorry, I'm very sorry. I know this is where the cameras are. Okay. Yeah. So there are procedures that will be able to collect all the necessary information. In fact, not only from the point of travel within the country, but even within the flight, in terms of where they are seated, who their closest fellow passengers were. There are explicit procedures that record that information so that you can be able to monitor and track those individuals in the event that an individual turns out to be positive. That is the way we track, and we hope that it should work. I am coming. That was number 2. Your question, together with the question from the standard gentleman, raised the issue of why don't we, basically what you said is, why don't we just stop the Chinese from coming in? And I think that is a discriminatory approach, given now how the virus is spreading in many different countries. I started off by telling you the changing pattern of this virus. It doesn't mean because somebody is coming from China that they have it. I don't think anybody would want to be labeled that because you come from somewhere, you have this virus and we need to bar you. I know some countries in the early phases when they evacuated their personnel and they had seen certain cases in their country, they did exactly what they did is they closed their borders and did not allow anybody coming, and not only Chinese, they said anybody who has come from China, a history of travel in China, would not be allowed in. I think the USA is one of those countries, except their nationals, whom they then put on quarantine.
Well, what would you tell the parents of the children in Wuhan who the government said clearly they're better off in China than coming back to Kenya? Yet they're Kenyans, but the government is allowing Chinese nationals.
Let me tell you something which I think sometimes escapes us. What is happening in Wuhan and Hubei province, Wuhan city and Hubei province, is that there is a lockdown. Lockdown meaning that nobody is allowed in or out. And that lockdown has been in place in order to bring down the transmission of the virus, because that is the epicenter. And we're beginning to see that there's some level of improvement in that area. So let's not talk about bringing, because it's a lockdown and people cannot travel freely. But these other Chinese nationals and even Kenyan nationals and others who are coming in, they're coming from other parts of Kenya where there is of China where there is no lockdown.
But other countries like Italy has moved the nationals from Wuhan.
Yes, several countries have done that.
In Italy.
Yes, several countries have done that. We are now moving into the area of the students and evacuation, which I would not want to address, because I think Ministry of Foreign Affairs should be able to address that. That's the issue. But with respect to travelers who are coming in from China, even if you stop flights coming in from China, flights come in and connect at different places. We have Ethiopian Airlines, we have Emirates, we have Qatar, which are active in that region in general, and they bring in passengers through transit. So it is not a solution to solve the problem now. A point might reach where that may be necessary. Yeah? But I think we should be careful not to label people in a certain way. I think it would be dangerous to do that. Yet we must always be careful that we are protecting our people as well. I think that is not lost upon us. We want to protect our people at all cost. Okay?
So, any other questions?
Yeah, my name is Christopher from I'm just wondering if at all the government has a mechanism to monitor these people who are under self-quarantine. Have we mapped out? Do we know where these 239 Kenyans are?
Yes, they are known. Their contacts are known. Where they are staying is known, both by us as well as the embassy, Chinese embassy. We have their phone numbers and contacts.
And immigration.
As well as immigration. The Department of Immigration also collects the information. So we have this information and we know where they are, and we monitor them, both as a ministry and the county level as well, and the embassy themselves. Call these people very regularly to find out what their condition is.
What will happen to some?
By the way, this quarantine, although we did it, this was a mass quarantine because of the flight, now the direct flight that came from China. But we had put this self-quarantine measure even earlier because Chinese nationals were still arriving on other flights. And the embassy worked with us in terms of imposing this self-quarantine. And it has worked fairly well up to now.
So talking of strict measures, what will happen to those who might? Because there are concerns, including by MPs, that there are some Chinese who are freely mingling with Kenyans. Yet there's some really access.
No, but you see, we can't say, because if this Chinese has has no history of travel in the last 14 days, there's no reason to say that person is a risk.
From the flight.
Yeah, but this one of the flight, that is information you are telling us. We don't know, but if it is happening, it is something that perhaps needs to be corrected and set right. But we have taken those measures to at least make sure that they're there. In fact, the Chinese ambassador himself said that he will, if there are any defaults, be able to follow up. Because most of the Chinese are living in these work camps where the companies are, the construction companies, the water companies.
Let's take two more questions.
All right.
Yes.
Captain Kabu from Citizen. Yes. Probably just let me start from there. These people are doing self-quarantine from their houses, from their homes, where they have fellow family members. At the end of monitoring, are they being monitored, the rest of the family members? Secondly, is this our own invention or is also being practiced in another country? And then thirdly, is it true that a Kenyan is tested positive in Vienna?
Okay. Okay.
From the same media, not the same.
Yes, we're CNN. Ingrid Foreman. The question about the case of monitoring. Number one, were all the passengers on that flight Chinese nationals? We understand there were Kenyans there as well. How exactly do you monitor them? Because you don't understand there's measures in place. So far you've told us that it's the Chinese embassy helping you monitor the Chinese nationals. What about Kenyans and any other nationals? On the airplane coming over, who does the monitoring there? And also, as you very well know, Kenya has been identified as a high-risk country by very significant international institutions and publications. As the highest risk country in East Africa, will you continue these flights from an area that's not the highest infection rate in China, but the second highest? Will you allow these flights to come in?
One last question.
Well, mine is on the map.
From
Hope Media. Mine is, well, we are making these people self-quarantine. And the basic aspect of any Kenyan who's on mobility is on basic assets that they need. How is the government doing and what is the government doing in the provision of other amenities that the people need for them to remain indoors for the next 14 days?
Okay. Let me start with somebody asked about self-quarantine cargo, is it?
Yes.
About self-quarantine and how we monitor? How we monitor this?
Monitoring.
Yes. Monitor is, as I said earlier, we have rapid response teams here. We have our emergency operations center. We have, if it is within the city of Nairobi, this is the team that monitors. They make calls. They may even visit the subjects. So that system of monitoring is there. It extends into county level for those who are outside Nairobi and within the counties. That monitoring level extends now to the county health authorities there, who under the guidance of the emergency response teams here are able to monitor. Okay? Now, your question was regarding family and whether there are standard guidelines. There are standard guidelines on self-quarantine issued by WHO. If a person has traveled and is going back to his household where there is family, self-quarantine means he must isolate himself also from the family within the house. He must remain in a particular room and not allow that contact, because that transmission can happen. In that case, then, that is the person who is under self-quarantine, as long as he observes those conditions of not freely mixing with members of his family within his household. Because of the way the virus is transmitted through close contact, through air droplets and so on, he will be the quarantined person. However, if he does mix with his members of his family, then the entire family is under quarantine. Okay? Now, many of the Chinese who are coming here as workers live alone. So it is not an issue. They self-quarantine in their facilities on their own. Okay? The question from CNN was, how do you monitor again, isn't it? I think I have answered that in terms of the monitoring process.
We don't understand how an individual, it doesn't have to be Chinese, any nationality, Kenyan, businessman coming back from China who has goods to sell, how is this person monitored? How do you...
In the same way, the person is instructed that he is given strict instructions according to these guidelines on what to do. Go home, do not leave your home. If you have a family, isolate yourself, and for 14 days.
So it's an honor system, basically, you're relying on.
It's a
honor system. You trust the person to do this themselves.
There is a level of that, I would say, yes, because people have to be careful about their health. If it were me and I had a family, and I was told that that was the option, of course I would isolate myself and not pass the risk on to members of my family. But there is the monitoring system where, you know, the individual is asked to continuously monitor himself, to check his temperature. If he feels a fever, if he feels anything, he contacts the medical team and then they are able to come in and provide the services that are required or take the necessary action. This might even mean taking samples now to find out, does the patient meet the case definition criteria, and if he or she does, samples will then be taken to confirm whether it is this coronavirus 19 or not.
And the nationalities on the plane?
Nationalities in the plane, we had 239, 198 were Chinese, 30 were on transit. 30 were on transit. 30, wasn't it?
Yes, yes.
30 were on transit, so they just transited through.
And
And the rest were the crew.
So no Kenyan nationals?
13 Kenyan.
13 Kenyan nationals who were given the
Yes.
instructions for self-quarantine. And the context and details are also available.
And the last part was, will these flights continue as Kenya being identified as
We are monitoring very carefully what's going on and how it is spreading. And there are discussions about this. At this point in time, I'll say that the discussions, very, very serious discussions, are happening. And if a decision is to be made, it will be a government decision that involves, all the different relevant ministries. Yeah. So.
Any other questions apart from self-monitoring?
The Vienna question.
Vienna question.
Yes, Vienna.
We have checked with the Foreign Affairs.
Yes.
There's nothing like that.
I am informed because earlier on we were told about this. My colleagues say they have checked with the Ministry of Foreign Affairs. They have no information of this case in Vienna. So we have no official information as of now about this case.
The self-quarantine, is it Kenyan invention or something?
No, it is international practice. As I said, the WHO has a guideline. Many countries have implemented it, from Australia and many others have implemented the self-quarantine mechanism. Remember, the self-quarantine is an extreme precautionary measure. When somebody is quarantined, it doesn't mean that that person is sick or even exposed. It is simply because that person is associated with travel from an area where the virus was circulating that you do not want to take any chance, but you want to keep that person separated, allow the 14 days of incubation to elapse to determine whether that individual is infected or not. So it is an extreme precautionary measure. Okay?
Thank you. Hope it's not
related. With the level of mistrust and anxiety in the country caused by this coronavirus outbreak, would it have made more sense for the government to just isolate these people for these 14 days instead of releasing them to the general population, just to calm down the fears? What would that have cost the government?
Okay, first of all, I want to correct you about isolation and quarantine. And again, that is some part of the thing that is fueling this misconception. Because when you talk about isolation, you are talking about somebody who's carrying the virus. So these
people who have actually been confirmed positive after 14 days of incubation.
Yes. Those people, yes. Positives is.
After they've been released after 14 days of incubation.
But those are the minority.
Is confirmed.
A case will be confirmed within the 14-day period if there is indeed a case, because the symptoms will have developed, and what we call the case definition symptoms, because it's not just any symptom, it is particular things that must happen together. And once that happens and a test has been done that shows the virus is actually present in those fluids from the nasal, from the nose and other parts, then that person is now what we call a confirmed case. The person is carrying the virus. That person then must be isolated in a hospital setting and must be supported and given the appropriate treatment to recover. By the way, this virus, although it spreads very fast, in terms of its fatality, it is rather low compared to some of the other viruses that have come out in the past. I think the case, what we call case fatality rate for this virus is in the range of about 3 to 4%. Most of the people will recover. Some will have a severe disease for a while. They may recover, but about 3 to 4% will succumb to the virus. So containment and prevention of spread is what's important. prevention of spread, because you can imagine the costs and of containing people who have contracted the virus. We're talking not now about quarantine. Now we are talking about isolation of large numbers of people. This is what happened in the epicenter in Wuhan, in China. So yes, it is. If it gets to that stage, it becomes a very, very costly exercise. It will impact on society. It will impact on the economy. So we hope and we pray we don't get to that level, and that we will continue to put these measures and to strengthen these measures that we have put in place. Thank you very much.